So what do we do now? Collaboration, as we spoke about this morning. When it comes to healthcare, workforce, we looked at various dimensions. We looked at the influence. The conversations that we had today was so enlightening, and we've identified that in reimagining healthcare, there are various sectors that needs to be involved. Better facilities, better pay require financial resources. So finance needs to be in the room. The Department of Labor, what are the skill sets required? Let's examine the workflow. How can the workflow be made more efficient? What training is needed to get a person from one level to the next, right? For that, we need the Department of Labor, we need the Department of Education, okay? What are the healthcare needs? What are the new technologies coming in? What are the diseases? What are the treatment protocols? What are the skill sets that are needed for healthcare workforce? So that requires the Department of Health. That is a function of the Department of Health or the Ministry of Health. Yes, I'm not getting into what their job description is, but as we're reimagining healthcare, if there are any elements that were eliminated before, we'll need to consider them now to be successful in the 21st century. All right, and so there are four major roles that needs to come together to collaborate for healthcare workforce development to be successful. Finance, education, labor, and of course, the Ministry or Department of Health themselves. I don't know how I'm doing with time, but thank you for your time and attention, and I pause for any questions.
Oh. This one's not on. Oh, it's on now. Earlier in your talk, you talked about the mental pictures that people have of nurses today, and I will say that I'm one of those people who has a negative mental picture of what it would be like to be a nurse. The stories that I've heard haven't been great, and so I think my question is, from your perspective, what has been the best part about nursing, and what would you tell people to get them to want to be a nurse? And then on top of that, what do nurses actually want? So, like, what would make the job better? Because what I'm hearing from a lot of people now is if somebody says to me, oh, I'm going to become a nurse, they will say to me, because the money is good. And I'm not sure if that's exactly who we want taking care of the sickest of our people. So, yeah, I asked you 3 questions, sorry.
Okay, all right. So I'm going to try to take them one at a time. So the first one is, what would I tell someone who wants to be a nurse? Okay, so my personal experience is nursing is innately satisfying when you have a patient who is suffering, and then after taking care of them, they're telling you, oh, I feel so much better. There is something so satisfying, no amount of money can replace that. I'm not sure why that is, but it's true. And so the money also can be good. In some areas, it's really good. And unfortunately, here in Jamaica, it's pitiful. I can tell you that because when I first graduated nursing school and I got my first salary, my father reminded me of this the other day. I cried for about 3 days because what I was getting as, what do I call it, pocket money? My what? What I was getting from my parents to live was more than I got paid. So this was in Jamaica. And so I was working 2 jobs in Jamaica because I remember when I called my dad, I had to call him to get makeup to pay my rent. And he said, you're going to have to get another job because my job is over. And he didn't give me the money for the rent that time, but for the next month rent, yes, so I started working 2 jobs. All right. And so the need to live creates that demand, unfortunately. So one of the other things that nurses would want is, number one, livable wage. And the second is respect. The general feel is that nurses are last consideration. All other professions are considered before nursing, and nursing is such an integral part of the healthcare system. If every nurse decides not to go to work, the death toll would be really, really high in one day. So we need to begin to recognize the value of nurses. And in the same breath, I would love to encourage nurses to also recognize their own value and to begin to ask for it. How you ask for it, though, is not a matter that you're going to complain about it. Because when you complain, people shut down, people do not hear you. When you get angry, you're deemed combative and uncooperative. And who wants to deal with an angry person anyways, right? So what we really want to do is to actually command the respect that we deserve by presenting ourselves in a manner that commands attention, not by making noise, but silence can be powerful sometimes. All right? And we're not asking nurses to be silent. What we're saying is, be silent enough that when you speak, people want to hear you. All right? And so in terms of giving nurses, or nurses getting what it is that they want, we first need to not beg for it, not complain about it, but to command it, okay, in a manner that they can say, you know what, we should have been doing better all this time. The current image is not one that really encourages engagement. And so we'll need to work on that. So the image of nursing that we want out there is, nurses, we're valuable. In this room, in this conference, we've seen nurses who are diplomatic, they're intelligent, and they know what we need. So we need the rest of the nurses to come together. Social media, as we said, it can be a place of good, but it has been serving to make nursing unattractive to the nurses in it and to anyone that would want. So I would actually appeal to nurses, if there is something that is not pleasing to you, deliver it to your supervisors out of concern, from a position of concern for yourself, for your fellow staff, for the nursing profession. And then let us begin to engage meaningfully and actually get results, because the noise hasn't gotten us anywhere. It's just been more chaotic than anything else. Nursing is so very pleasing. I love nursing so much. And when I imagine nurses, I imagine that image on the billboard: calm, beauty, powerful force, And as I said, we have enough nursing leaders. One of the other things I would encourage is for nurses to be brave and to step up and to take on areas of responsibilities. We'll hear of something that needs to be done, and they can do it. They have the skills to do it. but sometimes they may be afraid, maybe because of some of the experiences we've heard here, where the supervisors may not necessarily be entertaining. But let us not bash our supervisors either, because the way we approach an individual is an example of who we will become if we get into that position. So we should begin to demonstrate what it is we want to see in others. You want to be heard, then hear first. You know, it's like be the example of what you want. And so I would encourage those nurses. As I said, there are very many who are in the background, and unfortunately there are some disassociation taking place where some persons really do not want to be associated with nursing anymore. And it's really sad. But there is hope. And we just want these nurses to be brave and to step forward and say, hey, I'm a nurse, I've been doing this for 25 years, this is what I've experienced, this is what we would love to see. Government, I know you haven't considered us a lot, but we do have a lot we would like to say, and we're requesting an opportunity to speak with you, amen, and take it from there.
I think I'm wondering if there is if currently this is deterring a lot of people from entering nursing at all, and then the shortage comes, and then from the shortage we have other issues. Is there like one place where all of the nurses go and they put all of their requests onto a survey online and make one forum where all nurses can go, they vote, and then nurses in an entire country could say these are the top 5 most important things to us. If you do this, then we can even use this as like a marketing tool, because those billboards don't exist anymore, right? Because it wouldn't really be that true based on what you're saying for the wages. So maybe that could be used to attract more people. And then from the hospital as well, they could say, come to us. We have these top 5 things that all nurses have said that they want, and we prioritize them, or something like that. That's just the first comment. But the second comment is pilots, they are not allowed to fly more than X amount of hours per month because they might kill everybody on the plane. And the only difference is that they're flying a bus in the sky that could drop out of the sky, right? But you are flying like a bus of people who are sick, and if you miss a step, someone could die. So is there like no way to get to legislation and say it should not be okay for a nurse to work more than X amount of hours in a row? And that is now part of legislation because it's not safe for either the nurse or the patients.
So in the United States, you do have legislation that says a nurse cannot work more than 16 hours within a 24-hour period. But that 8 hours in between, is it enough to get them home, back to work, rest, before starting another 16-hour shift? So in considering legislation for number of hours of work, it will need to be a little more detailed, because a lot of things are left up to interpretation. All right, so if I can work no more than 16 hours a day, I could work 16 hours for 5 days, and where does that leave you? As I said before, working 21 hours at least 12 hours a day, 21 days at least 12 hours, should have been a red flag. If it's not for the person, then for somebody in management. So yes, legislation needs to be a little bit more creative. We do have nurses associations. However, what you find very many times is that they tend to become politicized. And if it's a cash-strapped nurses organization, the funding for lobbying, etc., is not available. They remain at a disadvantage. Now, it's so funny because they used to say there are power in numbers. But now I wonder if that's really true. Because with so many nurses, why is it that there is not enough being done? So it really comes down to the strength of the nurses' organizations and in many cases, what they choose as priorities. But we're in a stage now where, forget about the this, the that, in terms of patient ratios and all these things which has occupied the time. If you don't have any nurses, the ratios won't matter, right? Right now, there are nurses who will call me and say, I'm taking care of 32 patients tonight. Somebody is not going to get care. All right, so the issue of workforce is a lot more serious than we recognize, and the workforce development from the attraction really is where we should be putting more of our conversation. So thank you very much for your comments and those questions, Ms. Sanguinetti.
Well, thank you. Great presentation, Carrie Ann. I see that you're advocating more for nurse deployment as opposed to nurse employment. What do you consider to be the ramifications of that in terms of stability, sustainability of the workforce, or to get a task done and guarantee that goal because it comes with an employed nurse rather than a contracted nurse or travel nurse? Because sometimes you have a facility where the person is not employed, so they don't feel obligated to come. But if you have an employed nurse, then you know that you are guaranteed that at least you have care for the persons on there. What are your thoughts on those two?
Thank you for that question, and thank you for the opportunity to clarify. When I consider deployment, I'm considering allowing the nurse the opportunity to bring their true personalities to their task. And I'll give you an example. I left a job. As a matter of fact, this is one of the reasons I left Jamaica. I considered myself fun-loving, really light heart. I love what I do. I'm highly skilled. And I was taking care of a patient that was like a 101-year-old. And they were having a hard time placing a Foley. So I went in because I have all my skills, competencies, and tricks of the trade. So I went in, I did my little thing, got the Foley, and I was like, yes! And I started celebrating in the room. And the matron walked in and scolded me, told me that I was acting unprofessionally, and I felt so terrible because in front of the patients' relatives, and others, and I thought, I'm being my soul is being crushed. Something beautiful just happened for this patient. So in terms of my deployment and not just employment, it's not just being rigid, but allowing us to bring our, what they call it in entertainment, it factor into the workplace. Okay, make it fun for people to come to work and to want to come to work again, right? However, your question remains valid. The agency nurses versus a nurse that is committed, and I say through contracts, and stabilizing our workforce is something that is very big for me. Full disclosure, I do have a licensed healthcare employment agency. I'm not currently using it because I'm more into workforce development. And when I work with employers, I know you have another question, Doc. When I work with employers, and as an employer myself, stability, knowing that someone is going to be showing up for work as scheduled, is very important. So employment contracts, employment agreements are very important. When I did my studies here in Jamaica, I had a 2-year bond, right, where I would work 2 years. So for 2 years, I'm employed to this hospital. And I ended up spending only those 2 years, not because I didn't want to, but because leadership made it distasteful for me to stay. So I left. But then I went to work at another hospital, again with a 2-year contract. And when I turned around, it was 5 years. I was like, what was I doing here? Because this organization, they kept offering education. So you would go from one skill set to another skill set, and you move from a med-surg nurse to a trauma nurse to a PACU nurse. So the education kept coming, so you kept staying. So you, even though the job was hard, there was an environment that fostered development that I really enjoyed. And so 2 years became 5 years. And even after I ended the contract with that company, I stayed on as a pool nurse for another 2 years. So there are things that can be done for employment security. And if persons, I would recommend, are going, say, leaving, persons have their options, and employment agencies, they're real and they do serve a really great purpose. And so as an employer, when I was employing for my hospital, I had agreements with the agencies to say, these are the nurses that I need, and they must come to an orientation so they know and they understand, and we lay out the expectations. The expectations are the same as with any other nurse, because by you coming to work with us, you are agreeing to take care of our patients according to our established standards. And so we didn't just have persons coming in today, this one, tomorrow that. No, we had them say 13 weeks, 18 weeks, and sometimes they were there for years. Okay, so it doesn't matter if you're using an agency or not. We must establish the expectation of stability, maintaining standards, and showing up for work.
I agree too. I know that nurses are known, most of them doctors, for following standards, guidelines, protocols, and that's great. But I think what you were getting at earlier was that when you take that into consideration, you almost act like a robot.
Yes.
All right. I don't need a robot. As an employer, I don't need a robot. Those will come. I need critical thinkers.
Yes.
I need innovators.
Yes.
I need persons to innovate and develop new things, and problem solvers.
Right.
And I think that's what we're looking for in all health professions.
Yeah.
Because that will make the difference between us and the robots to come. Okay?
That's true.
In the AI and artificial intelligence, etc. So I'm happy that you see what motivates you, and you will see that when we talk about working conditions, when people leave a job or migrate, sometimes it's not because of the money.
Right.
It is because of the gratification that they don't get, or lack of gratification that they don't get, by being innovative and being appreciated for the innovation and feeling good about themselves.
Right.
And I think we don't create the environment that is conducive to productivity, because we don't give persons the gratification or the accolades and the congratulations and allow them to have the freedom to innovate and be innovative.
Right.
And be creative. So I think that is what we need to do with our employees.
Thank you so much, Doc. I could not have said it better. Thank you.
Good afternoon,
Good
Kerry.
afternoon.
Thank you so much for your presentation and for creating this conference. I am a registered nurse, I mentioned that earlier, and I'm also a Jamaican citizen and also have my registration to practice in Jamaica. I've been a nurse for a very long time, and throughout my career I've worked as a clinician, as an educator, in professional practice, as a manager, and as a healthcare administrator, and now I have my own business. So along the way, I got my nursing license and was always looking for opportunities to come back and work here. And I'll say the opportunities are not there. I don't know where they are. So I just wanted to frame that, for people even considering, coming back to Jamaica, trained nurses to contribute, to make a difference, there's some kind of bottleneck, I would say, with the human resources piece. And I wanted to ask you, from your perspective, when you talk about all those industries collaborating, coming together in the silos, can you clarify from your perspective, where exactly are these industries at with even having the conversation and recognizing, at the end of the day, the patient suffers. So I just wanted to get more feedback.
Okay, so unfortunately, the need has to be communicated, because what we do have are industries right now that do not necessarily communicate. So when we tried to register College of Health and Allied Development in Jamaica, of course you register with the company's office, and then you try to see what are the statutes for certain things, and you recognize, number one, it's not there. The persons in the positions, they're not giving answers. And so you realize that there is really a big divide amongst the organizations and the ministries that really should be collaborating on something so important. Every ministry has, I guess, their portfolio, their focus, etc. But what we need to do, and I hope we're doing it at this moment, is to bring their attention that here is another area of grave concern that you have an opportunity to make a positive impact in. Now, as it relates to coming into the country and seeking employment, etc., there is a pathway. So I had a conversation with the Nursing Council a few years ago as I was trying to register the school, and they said many people educated outside of Jamaica do not meet the educational standards required by the Jamaican licensure organization. However, the information is not readily available to the general public. So you're not sure exactly what is required. And so the pathway is not clear. And if you have a license to practice and you have in another jurisdiction and you have your degree, is there a mechanism that can be put in place to validate your knowledge and competency to say, okay, now you're welcome to practice? So I think that part also is missing. So it's very difficult, not just for nurses actually, it's difficult for physicians, it's difficult for therapists whom I've had conversations with who just does not understand, and they decide, okay, I'll put my energies elsewhere. So what is happening now will continue to happen unless these people, the Department of Labor, the Department of Education, the Department of Health, and the Department of Finance comes together and creates the pathway from wherever it is that you are into the system. It's not a matter that if you're coming from here, you need this. It's a matter of for you to enter, this is what you need. Just to make that clear so that persons can choose to come in if they would like or not. That is if the opportunity exists. But, based on the conversation we're having, it does exist. And so we'll need to begin to prioritize that for us to be successful in the future. Okay. I hope that answered your question.
It does. Yeah, thank you.
Thank you so much.
Karen, I apologize for missing most of your presentation, but I had a situation with my bank card and I had to deal with it right away.
You're
Of course,
forgiven.
everything takes longer in Jamaica. Anyway, I don't know if you can answer this, but my concern is the aging population who desire, like myself, to come home within maybe next 3 to 5 years. I'm looking at that. Patient care, what is that looking like? What are we going to do? I mean, I have healthcare in Canada. I'll always be a Canadian citizen, and of course, I can maybe fly to Canada to do. I don't have any situation that compromises my health too much. So I maybe can go once a year to do my medical and all those procedures. But what about those who come and as they get older, they can't travel as much? Patient care, what is the state of that? Because many of us, when we talk within our groups overseas, we desire to come home. We love Jamaica. And the number one thing is health care.
Yes.
Who's going to take care of us as we age? And, especially for those with comorbidities, what's going to happen to them?
That is so true. And I think from yesterday when we had the permanent secretary and today when we had Mr. Chen, they did identify that those are areas of concerns and that resources are being considered for those areas. However, I cannot tell the speed at which, but I can tell you that based on personal experiences, having to go 40 miles to a healthcare facility is not one that promotes confidence. And yes, I do hear it a lot. When I say I'm going home, they say, you'd better go fix the healthcare system before you go. And I'm like, look, there are people in positions. What we need to do is to be supporting them. Okay. However, for us to support them, right, you can only support someone that has the same ideas as you are. And someone always says, if you have the idea, then it's yours. All right, meaning that we want to come home, but healthcare is an issue. Then let us see what it is that we can do. And I think from this conference, we've said enough. There are so many people that are willing to help. And so some initiatives that were put forward, I think for all the persons who wants to come home and wants to make sure healthcare is in a better position, then, I don't know if I can put Dr. Ewing as an advisor and a public health professional. If we can get guidance for these various groups as to how we can support the development of primary care, which I think is the greatest thing. It's about healthcare maintenance. It's about wellness rather than sickness. All right. And knowing that if I do get sick, then there are healthcare resources available with technology. And if you'll come tomorrow, tomorrow is really about the emergent technologies and what to expect. And that will also help us with what we can do, even in the remotest of areas, to ensure that healthcare is available as needed. And with technologies now, as we're talking, the only thing I could say is do not try to catch up, but you may need to skip a certain level of development and kind of fall in line in what is coming for the future. And so, being meaningfully engaged with the healthcare systems here, participating, gaining confidence, then yes, persons can come home. I remember there was this campaign a couple of years ago to come back to Jamaica, right? So, and of course, there is a really vibrant, what they call it, like medical vacation, what they call it. Where you come into the country, you do your surgery, you take a vacation at the same
medical
time.
tourism.
Medical tourism, right. Yeah. Medical tourism is actually thriving in Jamaica. So what we want to do is to extend it to the rest of the population. As the president of the Nurses Association was saying, there are opportunities to improve the facilities. And with technologies now, it may even be more cost effective to create something new than to try to retrofit technology into certain structures. So the strategy will have to be developed meaningfully. So tomorrow, when we speak about innovations, that's going to be a really important meeting as well. We have Mr. Gerald Hamilton, we have Mr. Stevenson and Mr. Ennis, who are going to be looking at healthcare innovations from a structural, technological, and management perspective. And then we have Dr. Litwinzik, who's going to be speaking about innovations for certain cardiac care. And I think that will help us in seeing what is possible for the future, so that persons who are wanting to come home can rest a little bit to know that we know that you want to come home, and there are persons who are interested in helping to transform the current medical condition to make it friendly for persons who want to come home to feel confident that the quality of care is available. We know that. The outcomes in Jamaica are better than a lot of the first world countries. It's just the facilities in which these care are being delivered is one of the challenges, and technologies to make it easier to deliver that same quality care to more people.
And the cost.
And the cost.
And the cost.
And the cost.
Because you remember when people retire, they're on a fixed income.
Well, that's why they need to come to Jamaica, because the cost not so bad.
Well, it depends. Well, I guess it depends on the money situation.
Yeah.
You know what I mean?
So in terms of cost, I wouldn't even touch that, because I do not see that as a barrier. It's the facilities and the availability of the skilled professionals. So the skilled professionals are here, the quality of care is here, but it is the ratio and the reach that, and the facilities within which it's being delivered, those I see as some of the challenges.
Well, tell Costa Canadian who gets to see the doctor for free, you understand? As opposed to when they come here and just to get consultation, it's like $30,000-$40,000. So the dynamics may look different for them, you know, in terms of cost. I mean, we know we have to pay for good care, quality care, but it's just a complex thing, because I think even to create a collaborative space for that to exist, again, too much bureaucracy, too much. Sometimes I just say too much talk and no action. You know what I mean? It's just talk too much, and that's my experience having lived here. It's just talk and no action. You know.
You know, I think
in some aspects, you know, I'm not saying cross the board, just in some aspects. But then, I don't want to take up any more of your time. Other people need to speak. So thank you for your response.
You're welcome.
Yes.
I just want to mention that one of the other areas of concern that arises a lot is the lack of continuity. For example, you'll have this political party in power now, and there may be excellent initiatives in place, but then when the new party comes in, that person wants to make a personal impact. So they come with their personal ideas rather than working on a shared goal. And so one of the things, and you know what, I actually said this to somebody the other day. I sent out an invitation, and the person is saying, oh, well, you know, I want to see you prove first. Okay, so this conference is not about you, it's about the people who need the information. So many times we put ourselves in the position and we work around making history for ourselves, leaving a legacy, etc., rather than putting our energies towards the people. So we have to be really careful about that, because we've seen it over and over where this is the truth as to why excellent initiatives are not done, or a recommendation, excellent recommendation, may be on a table, it may be on the permanent secretary's table, but this politician has this idea and is going to run with this, and then what should have taken 3 months takes 15 and 20 years before it comes to the fore. So as a past president of the United States says, not because it's not my idea, if it's a good idea, that's what I'm going to work with. So I would also recommend continuity. If you want to make a legacy, there are means of doing it, but not at the expense of people or health. All right, but just doing the right things, and then you'll be known for, doing the right thing, not just leaving a legacy or a building that somebody can see, and then an earthquake comes and tears it down, and 2 generations later don't even remember your name. But I'll give you an example. Last night, 2 persons met for the first time, and one person said, my mother is XYZ, and this person, I remember that person from I was a child. So this person has been out of the system for maybe some 50 years. They do not have a building, but their impact is still remembered. All right, so if we begin to become selfless, we'll have a greater impact, because now generations will remember this person. Yesterday, Ms. Sanguinetti gave us an example from the 1800s, this gentleman that said hand washing, aesthetics, aseptic techniques, and he was demonized. But now, his recommendations are the hallmark. So we should not be afraid of doing the right things. Even if it may not be appreciated now, the future will thank you.
I'll just end by saying it's really not about us, it is for the greater good.
The greater good.
And once we put that in our minds, then, Ms. Sanguinetti will tell you what will happen. Thank you.
Thank you. All right. Thank you so much for your time, and thank you for your questions. And we look forward to a beautiful future in healthcare.